Hi, I'm Navdeep. I'm a senior physical therapist and certified pelvic floor therapist at Impact Physio Sport Clinic. Today I'm going to talk about what is pelvic floor, its dysfunction, and how physiotherapy helps. A pelvic floor is made up of a group of muscles covering the bottom of the pelvis that covers bowel and bladder in men, bowel, bladder, and womb in women. These muscles look like a hammock running from the front of the pelvis to the back, that is tailbone, coccyx, and from one sit bone to the other. When there is any tightness or weakness in these muscles, it can cause pelvic floor dysfunction, bowel bladder incontinence, pelvic pain syndrome, pelvic organ prolapse, musculoskeletal dysfunction during pregnancy and postpartum, and several other conditions. How physiotherapy helps? It involves external and internal manual therapy, for example, scar tissue mobilization, myofascial release, pelvic floor exercises, relaxation techniques, core strengthening, electrical stimulation, biofeedback, postural retraining. If you have any concerns, please give us a call for consultation at 780-929-7272. Thank you.